planning board up in Lucas County. And every time a hospital wanted to buy an expensive piece of equipment or a building, they had to get a certificate of need. Well, now we've got an arms race. I mean, all you have to do is look at Ohio State. They're about $1 billion hospital at Riverside. Everybody's got their own heart center. Everybody's got their own cancer center. I mean, do we need all that stuff? And isn't that where a lot of the cost is coming in now? Because everybody's got to pay for all this expensive infrastructure.
Well, I don't think the government should be restricting the private sector from growing and building new cancer hospitals or other centers. I do, though, think, as part of my 10-point plan, when I talk about transparency, that's where I think transparency comes in important. And if there's a procedure that maybe costs $250 at one hospital, but they can come to this urological center here for $100, citizens should know that. And I think that's where transparency in the marketplace is important. And Frank, I'd like to pass it off to Doctor here, because inside his office, we were just talking about that, how through outpatient care here, they're able to do procedures in a lot more cost-efficient way for patients than they're doing in other systems.
Mr. Howlett, one of the things that I think you're overlooking in the Affordable Care Act is the bureaucracy that supports it. I have a document I'll give you before you leave, and I guarantee that you'll be surprised at the complexity of the organization, but I can give you the whole Affordable Care Act in your hands so you can look at it. From the standpoint of health care, my major criticism of the Affordable Care Act, and I've talked with Governor Romney about this when he was in Powell earlier this summer. I said it's interrupting the most important relationship in medicine, and that's the patient-physician relationship. And to meet the demands of these additional patients that you're adding to the group, that a very limited number of physicians, because we're short on physicians, can serve, is that lessor-trained providers will be put in the middle of that transaction. Now, you might think I'm biased, but I have a daughter that is a nurse who has a master's degree in nursing and will have a doctorate in nursing. So she will be doctor. And the point is, I think that transparency needs to be flowing from the top to the bottom to the patients so they know who they're getting their health care from and what it costs. And with that thought, I will say to Mr. Moody, who's behind me, we've talked extensively about making our costs here transparent. So you can look online and find out how much it's going to cost to have a cystoscopy and maybe a biopsy procedure done. And that will give us access, I think, to competition at this level, even though we're mired in bureaucracy. We're looking forward to that opportunity.